Good morning, and welcome to the PCOM Georgia Physician Assistant White Coat Ceremony for the PA class of 2023. Before we begin, I would like to invite Mr. Brian Ginn, Chief Campus Officer, to the podium to give the invocation, followed by Professor Lindsay Carruthers to lead us in the Pledge of Allegiance.
Good morning. Oh, come on, folks, we can do better than that. Good morning. All right, this is good. Dr. Levy, thank you so very much. On behalf of Chairman John Carney and Chairman of the Board of the PCOM Board of Trustees, Dr. Jay Feldstein, and our Provost, Dr. Ken Bite, both of whom are graduates of the Philadelphia College of Osteopathic Medicine, and in the very excited PCOM Georgia campus community, I am delighted to be here today, and I bring you greetings on behalf of all of us here associated with PCOM. It's great to be here live and in person, isn't it? Isn't it great to be somewhere live and in person? And I can tell under these masks, there are a lot of smiling faces in our audience here today. Thank each one of you for coming and being with us today. That we are gathered here is no small endeavor. In fact, the holding of this ceremony at several points in recent days was somewhat in question given the position in which we find ourselves in our community statewide in Georgia and nationally as well, given the growth and impact of COVID and its variant, the Delta variant. Some regions in Georgia, as indicated in the front page of the AJC, the Atlanta Journal-Constitution today, have exceeded, some of these hospitals have exceeded 100% of capacity, and others report 90% of ICU beds being utilized. As an institution of higher education focused solely on the health sciences, PCOM and its leadership team, we work diligently to ensure the safety of our campus community, and we do so by following the science. As future healthcare professionals, I trust that you appreciate this as we navigate yet again uncertainties and uncertain waters. Despite these difficult and uncertain days we all face, it really is fun to gather and be here together to celebrate this milestone of the white coat ceremony, one with the other. On a personal note, Dr. Levy, if I might take just a liberty for just a moment, I want you to know that I have great personal and professional respect and personal affinity for the profession of physician assistants. I am currently under the care of my dermatologist PA, as I have been for many, many years, as one of those individuals who grew up not knowing what SPF, sun protection factor, meant. So I see religiously I see my PA, dermatology PA, twice a year. I'm under the care of my cardiologist PA, with whom I now meet biannually to monitor my heart and its conditions from my significant COVID inpatient experience back in January and December. I'm under the care of my pulmonologist's PA for monitoring lung functions that emanated from my significant hospitalization from COVID back in December and January. And after 3 years of seeing specialist after specialist for gastric issues, as we get older, we face those kinds of things, and being shifted from place to place, my primary care physician's PA finally sat with me and he listened. He listened intently. He listened to everything that I would put on the table with him, and he said, you know what, I think we might have a gallbladder issue. And I'm standing here today 3 weeks to the day after my gallbladder was surgically removed, and I'm delighted that my diagnostician was my primary care physician's PA. So I tell you all that to simply say, yes, today I am a fan of your profession, and I'm delighted to be here with you today to celebrate this milestone as we honor the white coat and what it means to patients. I'm a patient, and I appreciate what the white coat really means. So today, as you are able in the audience, we ask that you might stand for an invocation and remain standing for the Pledge of Allegiance. Please stand. Pray with me, will you? Oh God, what a great day this is in the life of our college and our PCOM Georgia campus, as these physician assistant students are officially presented with new white coats, a symbol of authority and professionalism, understood by patients as enveloping one with intellect and knowledge and a reminder of compassion and care. May these students wear these white coats with honor and integrity, demonstrating empathy and true concern for the welfare of their patients with whom they interact and serve. May these PCOM faculty and staff members continue to give of their knowledge and experiences and insights as they strive to prepare these students for the life-changing impact they will make in the days ahead. May these family members who have sacrificed greatly through encouraging educational attainment be rewarded with great pride and feelings of significant accomplishment as they continue their support of these students in the days to come. Lord, watch over all of our first responders who are there for us each day. Cover each member of our military and their families at home and abroad with your blessings, and hold in the palm of your hand all members of all medical teams across this expansive globe who are on the front lines of serving others in this pandemic experience we all face together. These students we recognize today will one day be those frontline caregivers. We seek your blessings on each of them this day and forevermore. Amen.
And if you would, please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated.
Social perceptions of healers in our society are often represented by symbols of the profession. Few symbols of medicine are more recognizable than the clinician's white coat. Historically, the white coat has represented such things as the scientific method of diagnosis and treatment, and the adoption of aseptic techniques associated with cleanliness. I thought it interesting to see where the use of the white coat in medicine came from, and in total truth, we don't actually know. Some of those who have studied that history and written about it seem to think that it was, at least in part, a marketing ploy. It seems that doctors of the late 19th and early 20th century noticed that lab scientists were held in very high regard by the general public. These scientists were getting most of the credit for fighting disease and reducing the suffering that went along with those diseases. One powerful symbol of the lab scientists were their lab coats, which at that time were tan. Organized medicine saw an opportunity to improve that symbol by changing the color to white, thus combining lab science and the notion of cleanliness, not to mention the pure intention of healing the sick. And before long, the long white coat became the doctor's trademark. In our current era of the 21st century, most people would agree that the coat emphasizes the humanistic value of patient before self, to which all PAs adhere. You who are newest to our profession will wear your white coats for the first time today, and this ceremony is meant to convey the importance of that. I'd like to invite our speaker, Haley Queen, PAC, to the podium at this point.
Thank you, Dr. Levy. A few months ago, I was rocking one of my little boys to sleep. I refused to put him down because he's too busy during the day to sit with me. I was using that time to cuddle him, but also to catch up on some emails. In my inbox, there was an email from Professor Becker, and in it, he asked me to be the keynote speaker here today. The first thought that popped into my head was, my husband and my parents think I'm great, but PCOM? It took me a second to regain my composure, and then it hit me. As the newly elected president of GAPA, or Georgia Association of Physician Assistants, I had better start refining my public speaking skills. I should probably apologize to you today because you were my initiation. In the last 2 months, I have lost many nights of sleep and written so many notes on my phone trying to decide what to speak on. I keep asking myself, 12 years ago, what would I have wanted to know, hear, or learn that I had to figure out on my own? I still don't have all the answers, but hopefully you can take something away from me here today. I have to give you a little background first. My father is a loud Yankee who knows no social boundaries. He is an amazing human who has helped me to become a person who rarely gets embarrassed. My white coat ceremony was in a beautiful ballroom in downtown Savannah. The entire drive to the ceremony, I kept prepping my father. Dad, you have to act right. Don't do anything crazy. Tarzan is not appropriate. On the side, I was begging my mother, Mom, please make him behave. In true Kevin Eddy form, my father, in his suit and Birkenstocks, made it through the ceremony without a ruckus. But as soon as we got into the parking garage, he let out the loudest Tarzan yell that echoed for what seemed like minutes. I didn't care. We were out of the building and had made it through the formal ceremony. Tarzan has been his way of saying he is proud of me since I started playing soccer as a little girl. I tell you this story for two reasons. First, although I'm not going to let out a loud Tarzan call, this room full of people and I are so proud of you. The hard work, dedication, discipline, and sacrifice you have given that has gotten you here to this beautiful ceremony today is incredible. I hope you can sit in this moment and be overwhelmed with gratitude and pride. The second reason I wanted to tell you that story was to highlight the formality of this event. The white coat is formal. It's professional. It's powerful. When you walk into a patient's room with a white coat on, you have the power to instill trust, wisdom, and healing upon a patient. You also have the power to cause doubt and fear just as quickly. The power of the white coat is sacred. It is given only to those who earn it. Many people don't know, but until the 1900s, the white coat was black so that it wouldn't show blood or filth. It was also a sign of formality, almost like a tuxedo. Medical encounters were thought to be serious and formal matters. Now, we have patients show up in hospital socks, no shoes, and PJs if we're lucky. But that's a conversation for a different day. There was a painting published in 1889 called The Agnew Clinic by an artist by the name of Joseph Eakins. The painting depicted Dr. Hayes Agnew wearing a white coat performing surgery in a theater, or now called an operating room. His support staff and assistants were also wearing white, and this was one of the things that launched the popularity of the white coat in the United States. The idea of sterility and health became associated with the white coat. It's undeniable that the white coat is a symbol of healing, a symbol of a profession, a symbol of trust. It also can symbolize fear, sickness, bad news, or conjure emotion and memories from long ago that might not be pleasant. The white coat is meant to be worn with pride, but also with humility. You are a human being sitting in front of another human being, practicing medicine. The white coat can be practical. It can hold books that you can reference. I'm old, so I prefer a pharmacopoeia in book form over my phone and all the apps it has to offer. Pen lights are carried to check pupil size, and your stethoscope, which you should always have on you to listen to the heart and lung sounds. There will also be all your cheat sheets for dermatomes, how to calculate body surface area for burns, ACLS, etc. There's nothing like that first time you're standing in the middle of an ICU when someone yells, "Get the cart!" and you're the only clinician in sight. I'm sure y'all would never think to do this, but when I was first starting out, a little voice in my head would whisper, "Get low and find the nearest bathroom or closet." I, of course, never did this, and very quickly my confidence grew. But in the meantime, while I didn't pull it out to look at it, that cheat sheet in your pocket just gives you some security. Also, I learned very quickly that nurses can run a code in their sleep. They don't really need you, so let that take some of your stress away. Your white coat is also an identifier. It obviously identifies you as a clinician, but the length of your coat is an indicator of where you are in your training. Students wear short white coats. Graduates or practicing PAs wear long white coats. When you become a practicing PA, hopefully your white coats will be dry cleaned by the practice who employs you. Until then, make sure yours is clean and pressed. Last but certainly not least, your white coat will carry your snacks. Meals aren't promised, so make sure you have them. While the white coat carries many practical, tangible items, it will also carry memories. It will carry the highs and lows and the lessons learned that will make you a better PA. Today, I want to share a few of my memories and the lessons learned with you. I was in cardiothoracic surgery for the first 6 years of my career. My next 2.5 years were spent in the emergency department. I have seen a lot of death, sickness, and tragedy. I've come to realize personally that death itself is not what is hard for me. What is hard for me is when you do all the right things. You order all the right tests, give all the right medicines, the patients can even get the right surgery, but in the end, the patient can remain sick or ultimately pass away. This is what is hard. One patient in particular stands out to me. He was the father-in-law of one of my colleagues at the hospital. She came to my surgeon and said, "Hey, can you review these scans? My father-in-law was coughing up blood and got treated for bronchitis. He still had a cough, so they did a chest x-ray and found a mass. He had a normal bronchoscopy and a normal PET scan at an outside facility, and I just want a second opinion. We sat, looked at the films, and right away my surgeon said, let's take him to the operating room and get some tissue. We did a mediastinoscopy, and tissue pathology was negative. We did a Chamberlain procedure to follow, kept him in the hospital overnight, and again, his pathology came back negative. Still, no answers. Then we ordered a CT-guided biopsy. Finally, an answer, histoplasmosis, or a fungal infection. He got a same-day infectious disease consult and did 12 weeks of antifungal treatment. 12-week follow-up CT scan showed that the mass had grown. Repeat PET scan was positive at the site of the mass as well as both adrenal glands. Biopsies confirmed stage 4 squamous cell carcinoma. He had metastatic lung cancer, and despite radiation and chemo, my friend's father-in-law passed away 8 months later. You don't have to understand any of the medical terminology here to know that every effort to get this man and his family answers was taken. The appropriate testing and diagnostic procedures were performed, and yet he died. Compassion. The word literally means to suffer together. The white coat you are receiving today is a symbol, a practical object, but it is also a bond. It's a bond between you and your patient and the patient's family. You will suffer while wearing this coat, but what an honor it is to suffer alongside your patients and their families during some of the hardest times of their lives. You, in your white coat, are an offering of hope. People always want to cling to hope. My white coat also carries some of the most amazing moments of my life. The good days outweigh the bad exponentially. I've been able to pray with families while their loved ones are being taken for emergency surgery who have a 50% chance of survival. I've been able to stitch up a child's arm while keeping him laughing and comfortable after a very traumatic experience at a prior visit. I've been able to diagnose so many problems that have gone either misdiagnosed or just been ignored. It's overwhelming to have someone crying in your arms out of sheer gratitude and relief. One of the sweetest memories I have was while I was working in the emergency department. We were slammed. I picked up a patient out in the overflow area in the lobby, 39-year-old female with abdominal pain, non-English speaking Hispanic. Pain had been off and on for a few days. She was feeling bloated with gas, nausea intermittently, and normal bowel movements. Her urine smelled a little funny and she'd been going more often. No back pain. Periods have never been regular and she doesn't know when the last one was. I asked a few more questions, did as good of a physical exam as possible with her sitting in a recliner, and off I went to order labs and urine. Her HCG popped positive, pregnant. I waited for the quantitative to come back just to see what her baseline was before I went back to talk to her. It came back really high, which was good, but didn't really tell me anything. You guys, I went to tell her with the interpreter that she was pregnant, and she started screaming and shouting and talking really fast in Spanish. Tears were running down her face, and I was trying to figure out what was going on. Turns out, she and her husband had been trying to get pregnant for 17 years. She had never had a positive pregnancy test and had been told by multiple doctors that she would never have a baby. I tried to calm her down and explain to her that I was really happy, but we needed more information before we could celebrate. She was alone, so she picked up her phone to call her husband and proceeded to cry nonstop for the next 45 minutes while waiting on the transporter to take her to the ultrasound. I had asked the nurse to call me when she left. Because she was alone, I walked down to the ultrasound room so I could be with her while they scanned her. Drum roll, please. 23 weeks pregnant with a healthy and wiggly baby girl. I still get goosebumps thinking about that moment. It's so rare to be able to give good news in the emergency department. She left the ER with a prescription for an antibiotic for a urinary tract infection and 17 weeks to prepare for a little baby girl who she had been dreaming of for the past 17 years. It does not elude me, the opportunity and privilege that this career has brought me. If you're still listening to me at this point in my speech, thank you. If you aren't, listen up. I'm almost done, but I have some advice for you. The evidence-based medicine, book-smart knowledge of being a PA is going to come. PCOM and this faculty are fantastic. They're going to equip you with everything you need in your arsenal to pass boards and become a PA. The transition from didactic year to clinical is the kicker. This is where you learn to interact with physicians, nurses, fellow PAs, nurse practitioners, lab techs, and most importantly, your patient. Diagnoses are made from good histories and good physical exams. These things take time. As a PA, we are blessed to have time. The surgeons, the internists, the endocrinologists, the oncologists, the neurologists, they're all drowning. They want you to take the extra time so they can move on to the next thing. They are stretched so thin, and we are the glue that holds everything together. If you work with a good physician, they will acknowledge this. I hope for your sake you can work with physicians who acknowledge your worth both as a person and a clinician. Don't just treat numbers, treat the patient and their symptoms. While you're at it, treat the family or the caretaker. Look at the person sitting beside your patient and say, "How are you? Do you have the resources you need at home to feel supported? What can we do to make this easier on you?" Say yes to a last-minute consult or a double booking in the office for a referring physician. Some of this will come naturally, but a lot of this is learned behavior. It's a skill. You have to learn what resources you need, where they are, and who to contact to obtain them. Treat your caseworkers with respect. Utilize your pharmacists, physical therapists, drug reps, and home health nurses to the greatest of their abilities. This life you are living now, it's not a competition anymore. You have won. You are sitting here about to put your white coat on. Now, the name of the game is collaboration. Be nice to each other because you never know when you're going to need a quick off-the-books consult. That person sitting beside you might have the answers to your question in 3 years. This ceremony is not only a celebration of who you are today, but also of the clinician you are going to become. So today, I want to challenge you. Be better. You are more than capable because you made it here today. But don't just be capable, be better. Go above and beyond. Be human, be compassionate. These things will set you apart. Make yourself invaluable to your physician, your practice, and your profession. 12 years ago, I sat where you are today. Since then, I've married the man of my dreams, had 2 beautiful little boys, changed jobs 4 times, gained 15 pounds, and have a lot more gray hair than I did at 22 years old. My heart is so full it could burst. I can't believe I get to live the life that I do. I have an amazing job doing vein work in an outpatient setting that most people would think is boring, but I love it. I love my patients. I get to come home every day, eat dinner with my family, and put my children to bed. The career you have chosen is the best out there. You have the flexibility to meet whatever needs you have in whatever season of life you are in. Take care of yourself physically, spiritually, mentally, and emotionally. Work hard, but make sure to play hard too. You won't be able to serve your patients well unless you are taking care of yourself. Don't forget to thank your family for helping you get to where you are today. Take your parents out to a fancy dinner with your first paycheck. They have been feeding you figuratively and literally for the last 20 plus years. It's the least you can do. The last year and a half, the world has been turned upside down by this pandemic. The COVID-19 virus has taken so much from so many people. I did not want it to take the spotlight here today. I do, however, feel the need to acknowledge it. I want to recognize the tragic deaths, the horrific obstacles people have had to overcome, the unbearable exhaustion, and the pure chaos that it has brought about. There has also been unimaginable strength, community, and growth born from it. I can't imagine the challenges you have had to face and will continue to face moving forward as a student in a pandemic. The flexibility, the endurance, and the fortitude it is requiring to navigate these circumstances is unfair. All I can say is you're going to be incredible physician assistants having walked this road in these conditions. Dig deep during these tough times and find a way to learn, grow, and feel joy despite this virus and the hardships it brings you. I'm going to close with a prayer that my husband and I pray over our little boys every day when we drop them off at school. Lord, please help them to listen, to learn, to be kind, and to love everyone. Amen. At the end, my husband always likes to add, work hard and don't let anyone make you feel bad. Thank you for having me here today. It's truly been an honor. Congratulations, PCOM PA Class of 2023. Cheers to you and your family.
Thank you, Haley, for those impactful words. I'd like to invite Dr. Rebecca Thomas to the podium to say a few words about the significance of the white coat.
There is arguably no other workplace clothing as symbolic as the white coat. The white coat stands for professionalism, integrity, and the highest commitment to caring for the sick. It conveys respect and is a visual reminder of the trust we must earn from our patients. A study was done at the University of Michigan that evaluated patient response to provider attire and the white coat. This study surveyed 4,000 patients at 10 different U.S. academic medical centers. The results of the study indicated that patient response was influenced by provider attire. The patient's response was affected their impression as well as the satisfaction with the care that they received. Providers that wore white coats over their business attire were deemed to be more knowledgeable, trustworthy, caring, and approachable. However, we recognize that in certain settings, such as a pediatric practice, we intentionally remove the white coat to allay patient anxiety. What we wear is an easy thing to modify. You embody the white coat. Developing and refining your character is not easy. It requires conscious effort and commitment. Choose to make your character a priority starting today. Carefully consider your words and actions, as they will greatly impact others. Exercise good judgment and solicit the wisdom of others to ensure the highest quality patient care. Value the privilege of serving those in need of medical care. The white coat stands for professionalism, integrity, and the highest commitment to caring for the sick. Wear your white coat with pride and be the person that exemplifies the traits that the white coat symbolizes. Now, I'd like to ask Dr. Levy back to the podium as you prepare for the donning of your white coat.
Thank you, Dr. Thomas. We will now help each of you into your white coats. Please proceed to the stage as directed earlier. As a courtesy and so that everyone can hear each name as I call it, please hold your applause until all students have received their coats. Kylie Boberts. Adriana Booker Rojas. Andrea Burkle. Elena Chouanier. Soren Circa. Ryan Crane. Stephanie Daniel Lopez. Abigail Fittler. Vanessa Franz. Daniel Hyder. Haley Handerhan. Bailey Hartwig. Megan Jewson. Amy Kennedy. Gia Lee. Kelly Lefam. Mariana Liquidano. Courtney Nguyen. Ha Nguyen. Harold Patel. Neil Patel. Vanessa Peter. Emma Puntalti. Myra Ramirez. Natalie Rincon. Kaylee Roper. Shomi Shaha. Alessia Severino. Tamia Wayne. I'd like to invite Professor Carrie Nold to the podium to lead us in the Pledge of Professionalism.
All right, PA students, stand with me, raise your right hand, and read the pledge as I do. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patients' autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medical practice. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand knowledge within the profession. These duties are pledged with sincerity and upon my honor.
You can be seated. In closing, I'd like to share some advice with you regarding your new white coats, in particular about what to keep in the pockets of your jacket. You have several large jackets in your pocket that you'll fill with instruments and items that add about 5 pounds to the average PA student. Here are some of the items that will fill your pocket. A reflex hammer. This is key for the neurologic exam. but it's also useful to use as a gentle tap over your temporal bone to help you retrieve that piece of information at that crucial moment when your preceptor asks you the most common cause of community-acquired pneumonia. A measuring tape. You will measure skin lesions, lacerations, pregnant abdomens, and swollen legs. You can also use this to check the size of a new microwave at Home Depot when yours dies. A pen light, used to check pupils and oral cavities, or to check for change under the seat of your car when you need something from the vending machine. Tongue blades. There never seems to be enough of these in the room when you have to see the back of a defiant child's throat. Keep a few of these in your pocket so you don't have to run out of the room. You'll also be happy when you've managed to pack yourself a nice dinner and there's not a utensil in sight with which to eat it. Tongue blades aren't great, but they will get the food into your mouth. Your cell phone will act as your peripheral brain. You will download apps like Hippocrates and UpToDate to help you remember the vast amount of medical material that exists. They also house important photos and dates like anniversaries and birthdays of loved ones. Don't forget those dates. Additionally, you will likely have a blank notebook to log your patients for the day, a pregnancy wheel to determine a patient's due date, a handheld Snell and eye chart, surgical tape, scissors, hand sanitizer, a face mask, breath mints, when the only thing you've eaten all day is Doritos. The following items are perhaps the heaviest but most important to keep in your pocket. Courage. The pandemic has changed the medical landscape, perhaps forever. Be the leaders that we need. Embrace every opportunity to challenge yourself. Endurance. Your hours will be long, your mental and physical capabilities stretched, but the rewards will be great. Humility and kindness. You will spend the bulk of your careers caring for patients one at a time. In our current healthcare environment, the pressure to see many patients a day, it's often easy to forget that this sole patient is not a connected entity. That patient is someone's son or daughter, brother, sister, spouse, or parent. And for that reason, it becomes important to remember that what happens to your one patient affects many people, sometimes deeply and for a long time. Please try to remember that while illness and death may become familiar to you, it is not to those who know and love your patient. I'd like to ask the physician assistant students of the class of 2023 to do a couple of things. First, look to the front of the room. This is the faculty that will guide and direct you in the studies of both the science and art of medicine. They are experienced, they are knowledgeable, and they, more than anyone else at PCOM, know what you need to become great PAs. Now look to your family and friends. You might want to thank them again for all that they will do for you over the next 2 years. And to the family and friends of our new students, I wish to leave you with a friendly warning. You are about to become involved in medical education of sorts. I'll bet you didn't imagine that just because you knew someone who was going to PA school that you would be a medical educator, but it's true, and here's why. You have ear canals and nasal passages the students will want to stick their brand new otoscopes into. You have retinas the students will examine with their ophthalmoscopes. Do you remember the spots that you used to see when you had your picture taken with one of those cameras with the old flash cubes? Well, the halogen bulb of an ophthalmoscope at full intensity is much worse. You also have chests and abdomens that they will want to percuss and palpate, poke and prod. You have lung sounds and heart sounds that they will listen to over and over again with their new stethoscopes. In short, you are about to endure the longest and most thorough medical exam of your lives. So please be patient. The students will thank you, and eventually their patients will benefit from the teaching that you provide. Thank you all for coming today. This concludes our ceremony.